Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to share with you the Arthrokinematic Restoration System. So, the Arthrokinematic Restoration System is a systematic approach to addressing joint pain or arthritis. So, arthro meaning joint, itis, inflammation in the joint. 1 in 4 adults in the US has a diagnosis of osteoarthritis. So it is prevalent. And we have drugs, we have surgery, or you have us, the physical therapist. And what is out there is mainly general exercise to address osteoarthritis, and stretching and exercise can be helpful, but there's not been one approach that has a systematic way about going to address specifically arthritis and a joint problem with the mechanics. So this is a biomechanical approach as well as a biophysiology approach. So what exactly that means is we're going to consider mechanics, and then we're also going to understand the physiology and how the body functions and works for addressing how to correct the biomechanics. And so it is a systematic approach. It's something that I developed over observation in my patient population for the last 17 years. I've used various interventions and different strategies, and I started to see a pattern. And once I started to use the approach after I thought about it and could apply the theory, it just seemed to work over and over. So that's how this came about. And before I speak any further, I'm going to speak a word of life from Psalm 139:14. I will praise you, for I am fearfully and wonderfully made. Marvelous are your works, and that my soul knows very well. So I find the human body very fascinating and how it works. And treating chronic pain has been an area that I have gravitated towards. And age 40 is kind of the magic number sometimes for joint pain to show up. And that may be because we start to tear down our joints faster than we are regenerating. And yes, there is wear and tear on the body. And so this is a short synopsis of the Arthrokinematic Restoration System, the key to unlocking arthritis. And I just want to briefly share what it is. I've done a video for all of the major joints, and you can look them up putting in Arthrokinematic Restoration System and then whatever joint you want to see. And I've gone through and explained the mechanics and how to use the Arthrokinematic Restoration System to address that joint. And working with a physical therapist is paramount to piecing apart the mechanics of something that you are specifically wanting to address. And if you have a joint movement or problem, pain with a certain movement that you have, you can put it in the comments below, and I can share strategies and how to address that. So the goal of this channel is to provide physical therapy intervention strategies and nutrition tips to improve the quality of your life. So the diarthrodial joints are the most movable joints in the body, and that's going to be your elbow or knee, your hip, shoulder, all of those joints. And they have different surface movement. Arthrokinematic, so arthro meaning joint, kinematic is going to be movement, and arthrokinematics is that joint play, joint movement. And most of what physical therapists have done over the years is to do joint mobilizations, and it's addressing the glide in the joint. So we know that the joints roll and glide in certain directions. And so you figure out which joint you're working with, how those surfaces move, and the concept is you're going to release and stretch the fascia, which is the connective tissue, and the muscle tendon unit that is going to oppose the glide, and then you strengthen in the direction of the glide. So first we figure out what mechanics we're dealing with, and then we apply an approach that is theoretical over that. So it's piecing apart the biomechanics, but then considering how that physiology respond. So cartilage, it actually, in-bone cartilage doesn't have any nerve endings in it. So all the pain is coming from the bone, the ligament, the sensors that are in the joint capsule. So that's giving us that information of pain. And pain is the signal to let us know that something's wrong. And what I've seen over the years is you're going to have pain before the breakdown because the pain is saying, hey, there's a problem here. Let's correct this. And what I find, if you can correct the mechanics, it's like your tires on your car. They're going to wear, and if you are going to balance them or you're going to adjust them so that the wear is even, then you can keep that joint health. So the whole idea of this is to restore the joint health as best as possible. And there's a nutritional side to this as well. And I get in that in this small synopsis as well of the joint health and how you can use nutrition to aid in the recovery. And one of my focus on this is to really offer other options besides going towards drugs and surgery. And it is very common now to have joint replacements. And I'm just sometimes wondering, how can we preserve and keep our joint health longer and not rush right into or jump into some of these options. And I am super grateful that there is the medical side of being able to address these problems that it can lead to a lot of dysfunction where, when it's time, it's time. There is a point of no return in a degenerative joint. So this isn't something that can be, it's something that may be helpful, but not in all circumstances. And it also has precautions and contraindications as well. So I get into more of that, and I will visit this and talk more about the arthrokinematic restoration system, but it is a systematic approach, and it is a physical therapy, a systematic approach to addressing osteoarthritis, and it's the only physical therapy intervention strategy that I am aware of to date that has a systematic approach to helping with arthritis other than just the general exercise, and there is strategy that we do use. So if you lose the range of motion, which is the movement through a joint, then you can have breakdown of the cartilage because you're not getting the health and the stimulation. So as we do age, we want to keep our joints healthy and keep the range of motion in order to preserve and keep our bodies healthy for longer periods. So I hope this is of help, and I look forward to talking more about this, and have a blessed day. Thank you.